everyone. Welcome to another episode of Hot Mic Cold Virus. My name is Rochelle Beard. I am your host, and I'm excited today to have Andrea Tanner with us, and we're going to talk about infection prevention in school nursing. Andrea, thank you for being here, and can you give the audience just a brief introduction about your experience and what you're doing now?
Sure. Thanks, Rochelle. I am so excited to be here with you today and talk about my experience as a school nurse. I've been a school nurse for the last 2 decades plus. I worked in Indiana, and over the years, I've continued my education, especially focusing on school nursing. And now I work as an assistant professor at Indiana University School of Nursing in Bloomington. I'm also a nationally certified school nurse and a past president of the Indiana Association of School Nurses. So my work has run the gamut, doing a lot of different things, but infection prevention is certainly one of those hats that I have worn as a school nurse and now as someone who trains future nurses and makes sure that they understand the important role of school nurses.
I feel like when you're working as a school nurse, those hats you get to wear, I feel like they just keep getting piled on and piled on, all the different ones that you get to wear, because then you're doing the infection prevention, doing the nursing and the triage while you're doing nursing. Then you also get to be like counselor. Sometimes I feel like discipliner in a way, very much critical thinking, trying to figure out the behaviors and what's going on and all that. So yeah, many hats you get to wear in that role. So let's touch a little bit on why infection prevention is extra important in the school setting. I mean, I think we know it is, but why is it so important within that school environment? What do you think?
It is really important because in a lot of our school settings, we are packing children into a small space like sardines. And we know that when we have lots of human bodies in a small space close to one another, infections are going to spread really easily. We have children ranging from the age of 3 in our early education programs all the way through seniors in high school and even beyond for students with special needs in our special education programs. So we have a lot of unique situations going on, not only because they're in proximity to one another. We have several that have weakened immune systems with lots of different health conditions. So definitely infection prevention is important in this particular setting because of a lot of different reasons. So school nurses play a really vital role in identifying all those different reasons why students may spread infections to one another and put a stop to it whenever possible.
Can you talk about I guess you don't really have a normal day as a school nurse, because every day could be different and something new could pop up. But give me a little bit of a breakdown on different illnesses, different children with different illnesses or chronic conditions that you could encounter on any given day working as a school nurse.
Absolutely. So on any given day as a school nurse, we may encounter acute situations, which may be acute illnesses or injuries that occur on the school premises. It may be that we're encountering something that happened before a student even came to school, and we're having to take care of that, whether that be a dog bite and having to deal with the ramifications of that. We've had kids come to school with a rat that bit them while they were waiting for the school bus. We, of course, work with children with chronic diseases, whether it be epilepsy, type 1 diabetes, food allergies, sting allergies. We work with those kind of situations. We work with episodic situations. And oftentimes we're encountering a lot of mental health concerns in our health offices and working to identify those struggles and handle those. And in addition to all of the common things that people obviously think about, I think a lot of people equate Band-Aids and ice packs with school nurses. But the work that school nurses do goes far, far beyond that. The scope of the work that we do, we have to adhere to scope and standards of practice. So there are lots of laws that dictate what we do. When it comes to illness prevention, it may be that we're having to understand who can we talk to, who can we share information with, who can we not share information with, what information can we share and not share. We're governed by both HIPAA, from a healthcare perspective, as well as FERPA from an education perspective on what information we can share. We also have lots of other principles by which we practice. We have a school nursing practice framework, and within that framework, we have the principles of care coordination, where we are providing that direct care to students for those acute, chronic, episodic, and emergency situations that enter our health offices. We're also working on quality improvement. We're looking for ways in which we can do something better, whether it's educate people, students and staff about infectious diseases and their spread, and then looking to see if we made a difference. Did we make a difference in chronic absenteeism? Did we make a difference in the amount of time students can be inside the classroom learning because of something we did as a school nurse, whether it be educating students in a classroom or whether something we did in the school nurse office? We also are leaders, and we adhere to this principle of leadership. And that can include identifying concerns and addressing those from a local policy perspective, a state, and even national policy perspective. I know just a couple of years ago, there was some state legislation where I worked with the Indiana Association of School Nurses to write letters of concern, because this legislation kind of whittled down the role of the school nurse to just what happens in the moment at school, in the school nurse office, and completely undermined the education that we do, the preventative work that we do, the work we do in championing vaccines and hosting in-school vaccine clinics. So many different things that we do as healthcare leaders in the school setting. And then certainly last but not least is the principle of community public health, where we are doing everything from trying to prevent the spread of illness, as well as identifying it early and tackling it early. So hopefully we can prevent something much larger affecting many students in our schools.
I love the focus that you talked about on not just while the kids are at school, while they're there. And yes, that's important, but understanding that's it's a significant part of the day, but it's not all of the day or all of their lives. And that your work in school nursing goes above and beyond and outside those doors, and really focusing on that quality improvement piece. I think as someone who's worked in quality improvement in healthcare, that's so encouraging to see it going outside of just healthcare and working within the school system and being like, how can we continue to make things better? And then it overall improves that, like you said, the chronic absenteeism. And that, I think that's such a great focus, and not something that probably comes to a lot of people's minds when they're thinking of a nurse working within a school. I bet it doesn't come to a lot of parents' minds either.
Mm-mm.
Maybe a few who are used to working with different like chronic illnesses or different challenges day in and day out, but probably not too many. And I think that is a fantastic focus. And then also with the legislation and being community partners and really working and taking the health of the students outside of the classroom and into the community, that is wonderful. And I'm so glad that you brought that up so everyone can hear about all the good work that you guys do. So that's great.
Absolutely. Thank
Yeah.
you.
Let's touch on some of the infections that we would see in schools. We talked about the close quarters and the different things you can see. So let's walk through a couple of these. Obviously, we've got respiratory illnesses, and those are very easily transmitted. I know strep can go through a classroom like nobody's business. We've got those skin infections because everyone's hands are everywhere. And if they've got some type of like ringworm or something, they're going to touch it and touch other people and touch other items. And I think one that can be super tough to tackle are the lovely GI bugs that ravage through any close quarters, whether it be at work. I know I've dealt with norovirus and I worked in the hospital, and I swear, I think we had 22 ill staff members within like a 24-hour period, split between two hospital units, because we shared coworkers and respiratory therapists and doctors, and that was lots of fun. So it can ravage cruise ships with lovely GI illnesses. So how do you tackle specifically GI illnesses because they're so contagious and easily transmissible?
Sure. So this is a great opportunity to again see how school nurses can be those healthcare leaders inside the school setting. So we try to tackle it through a lot of different avenues, through a lot of communication, whether it be announcements. We can come up with some really quippy and funny announcements at the high school and middle school levels to try to alert them to concerns and remind them to wash those hands. We're sending newsletters home and information with parents. We're going into the classrooms and we're doing hand washing lessons. And also reminding them that, especially for these GI bugs, hand sanitizer may not be effective at killing these bugs. And we have to wash our hands with actual soap and water. So we also work on surveillance, just keeping an eye out for classrooms that might be hot spots and communicating with families about that. And then, of course, working with our facilities teams. A lot of times they are trained to do some extra cleaning of high touch areas whenever we know that we have a GI bug that's going around. So a lot of different avenues for discussions, communication, teaching, and training, as well as actively trying to clean and do what we can from a physical perspective. And I'll share that probably the biggest GI issue that I ever dealt with was actually the spread of E. coli in one of the schools that I worked with. That ended up making national news, which is not anything that you want to do as a school nurse, is have your school and an illness spreading through your school make national news, but that did. And that was an eye-opening experience for me for a lot of different reasons. Number one, I worked in several different school buildings, so I didn't have the pleasure of working in one school building all day, every day. And so I am so eternally grateful for some really astute office staff who were taking phone calls from families and realizing, hey, I've had several families call in today mentioning their children were staying home because of bloody diarrhea. And not the bloody diarrhea like bloody British bloody, but actual really bloody diarrhea. And so they were in tune enough with this being a concern that they reached out to me right away to let me know, hey, something may be up. Several of these people were in the same classroom. We're hearing a lot of some parents saying the same thing about their child's symptoms. And we don't know what it might be, but we're concerned. And so I was able to communicate with those families quickly because of them being quick on their feet to get in touch with me about that. Then I was able to reach out to our local health department. And soon from there, we were able to find out from their healthcare providers doing the right tests and communicating that with the health department that we had a situation where several students had E. coli. And from there, of course, state epidemiologists came on the scene and began investigating. And before it was all said and done, we had several students in the hospital on dialysis because they had experienced hemolytic uremic syndrome, I think it's HUS, which can happen because of the toxins in the E. coli breaking down red blood cells and affecting the kidneys. So, so really, really quickly, we had something that seemed just like a normal GI bug become something of national prominence. So yeah, GI bugs can just be small GI bugs, and they can also be life-threatening. And school nurses see the whole spectrum and play different roles depending on what they encounter.
With that E. coli outbreak, how long about did it take you guys to get it under control?
It felt like forever.
Right.
And it's difficult to say when we actually got it under control. I would say over about a week's time is when we were continuing to hear of new cases and hear about how bad those cases were and whether students were able to remain home and heal at home or whether they ended up in the ICU in a hospital setting healing. But it probably took a couple weeks for us to feel like we were out of the clear, in the clear, out of the danger zone for that particular illness. But it was it took a lot longer to heal as a community from that because it was really really disturbing, and especially because we never really did get clarity as to where it started and what happened. And so that was That was alarming for a lot of people because we just didn't know. There were a lot of things we didn't know. And so a lot of people just had a lot of heightened concern during that time because they didn't know if they'd be next. They didn't know if sending their child to school was safe. And so, yeah, it just created a lot of concern for the community at large because there were so many unknown factors going along with that particular threat of illness.
Yeah, and definitely I think on the outside looking in, that could be very discouraging, not understanding where the source came from, especially for parents who aren't familiar with E. coli outbreaks or whatnot, can be very disheartening and scary because you are just like waiting for that other shoe to drop and your kid gets sick and then maybe a family member gets sick and it continue on. Were there any like things that stood out that you or the school system as a whole learned from handling that outbreak?
I think we learned a lot about communication, and there was quite a tightrope of this balancing act between communicating too much and communicating too little, the
Mhm.
timing of that communication, and a lot of that fell onto um, a team at the school system. It wasn't necessarily me, but people much higher than me who had that job of figuring out what that communication should look like and the timing of it. But we really leaned into the health department a lot for that. They helped kind of guide that process of what communication should go out, what that should sound like, when it should go out. So that was one of those examples where we had to learn to really work hand in hand with our public health system and our public education system working together to handle that situation.
And that's the health department's a great resource to highlight. I think a lot of times, maybe not so much in the school system, but definitely in healthcare facilities, people get a little timid about reaching out to the health department because they're afraid they're going to get in trouble. But they're not. They're not there to get you in trouble. They're there to help you and assist you and work through these problems because they have access to things that you're not going to have access to. They've got knowledge about different illnesses and treatments and what's been going on. Maybe there was a little cluster of an E. coli outbreak in the county over, possibly, and you don't know about it yet. And so they have access to all those different things. So definitely important to highlight them that always reach out to the health department for resources. They're there to help you and not there to tell you you're doing everything wrong. They're here to walk with you in during that process. You mentioned a little bit about hand hygiene and talking about education throughout all that. How does hand hygiene education go on within the school system? Obviously, you would think as adults we would know how to do proper hand hygiene. And so, like, but I'm sure you have issues and breakdowns with adults and the students within healthcare or within the school system. So, how do you educate everyone, all the different levels within the school system on something that we think is simple, but nobody can ever seem to do right?
Absolutely. So at the young level, at the elementary school level, we absolutely love bringing in all of our resources like glow germ and black lights to demonstrate how we can't see these germs with our naked eye, but they are certainly spreading whether we can see them or not. So we may set up with glow germ uh, dust powder. We may sprinkle it around some different areas in the classroom and throughout the lesson have students touching some of these areas that we have dusted. And then later on in the lesson, bring out that black light and show them how all these germs started out in this one little place and then it spread all over the classroom. We also do activities with glow germ lotion where we may have a few friends put this lotion on their hands, give friends some high fives, touch the pencil sharpener, things like that. And then we'll turn off the lights, get out that black light, and show them how those germs have spread. It doesn't have to be that high tech. You don't have to have the fancy glow germ and black lights. It could just be taking a handful of pencils, putting some glue and some glitter on them, and having an activity where the students pass it around like a relay race and seeing how many pieces of glitter are on everybody's hands, and then talking about how to wash our hands properly. And so So those are some ways that we could talk about the spread of germs. And we also, you mentioned that chain of infection, and that's probably one of my favorite things to incorporate into that lesson is all the different ways we can break that chain of infection, whether it be talking about the reservoir, our bodies maybe being the home of some of these germs, and how we can keep from being the person that passes this on to others by protecting the portal of exit, whether it be that germs can come out of our nose, our eyes, our mouths, and different places like that. And teaching students how to cough into their elbow, how to sneeze into a tissue and throw it away. And of course, making sure we wash our hands, talking about the mode of transmission and how hand hygiene plays a major role in that when we can wash our hands with soap and water for at least 20 seconds, cleaning underneath our fingernails and all the different places where germs like to hide. And then also talking about the portal of entry and all the different holes in our body where germs can get inside, and talking about how even something as simple as just touching your desk that somebody else touched and then rubbing your eye may get those yucky germs inside your eye. Picking your nose can get it inside your nose. Going to lunch without washing your hands can get the germs inside your mouth. And then also talking about the ways that we can not be a susceptible host by making sure we're getting plenty of sleep every night, eating healthy foods, drinking plenty of water, exercising to keep our whole bodies healthy so that we're not as likely to get sick if those germs do try to get inside our own bodies. So we try to take a holistic approach. And while we're talking about hand hygiene, we're also talking a whole lot of other things to make sure students really fully understand how germs spread from person to person.
I love that. Do you ever get does this like school nurse ever get brought in for like science class or something along those lines to kind of incorporate the health into maybe whatever they're learning for their current lesson? Does that ever happen?
Every once in a while, a school nurse might get invited to do something like that. Um, at the beginning of each year, when I was a school nurse, I always made sure and told all of the teachers, hey, I am here. If there's a lesson you would like me to teach your class, and I would give them a whole menu of different lessons I would be willing to teach, whether it's hand washing and communicable illness, whether it's nutrition, exercise, heart health. There were a lot of different things I was really excited to go into the classrooms and talk about. Some schools and some teachers were more open to that than others. There's a lot of
Mm.
pressure on teachers to cover all the things they need to cover, especially the things that are going to be included on standardized tests. And so that puts some pressure on teachers, just whether they feel like they have the time to incorporate something like that or not. Some schools are more open to that than others. I know for Title I schools, they are held very tightly to expectations about how many minutes are going to be spent teaching math and reading. And so sometimes they feel as though these types of lessons just don't have time to be taught. I would argue that they help students be healthy and that they'll be at school more learning if we can help prevent the spread of illness to begin with, and that these are really valuable lessons if we can take the time to incorporate them.
I support that argument for sure. 100% behind that for you. Um, so when you have an outbreak or just even an increase of illnesses in schools, which I know a lot of schools are in the area in this past flu season, I'm sure, and across the country as well, had some schools had to shut down for an extended period of days or do non-traditional education. And so how do you mitigate those situations as far as like, are there best practices or cleaning and disinfection guidance that either you as the nurse provides to staff or to maybe the facilities like the janitorial staff or the teachers as far as what they should use to clean and disinfect their rooms? Do you go into anything about like this wipe says keep wet for 3 minutes? If it is not wet for 3 minutes, you are not killing everything that it says so on here. And here's this virus that is not getting killed if you let it dry before it hits this. Is any of that going on? Or is it kind of like whatever they have in their rooms that were donated, it's a free for all? The staff, the janitorial staff has some Fabuloso and we use that. Like how does that go on within the school systems?
Sure. This may vary school system by school system. I know the school system that I worked in, our facilities team was very knowledgeable and very consistent about the cleaning equipment that they used and the cleaning supplies that they used. And we also have to be very careful. Again, it's a balancing act between the cleaning supplies that we use and like clean air concerns and making sure that we're not using different cleaning solutions that may ramp up somebody's asthma. So there's an interesting balance between all of those things, but our facilities team was really knowledgeable about that balancing act. They were very knowledgeable about the particular solutions that we used in our school system and very aware about the length of time it needed to sit on a surface before it would be killing certain viruses and bacteria that might be resting on those surfaces. So actually, our facilities team probably did a better job educating school nurses than them sometimes, because they were really equipped with that information and it was really impressive. So kudos to our facilities team and the people who are really working tirelessly day in and day out to keep our schools safe and healthy through making sure that they are clean and we're using the right solutions, using them for the right amount of time, and we're using them in a way and with the right timing so that we're not exacerbating asthma symptoms and creating breathing difficulties for some of our students too.
And that's a fantastic point about using like the facilities team as the subject matter experts. I think one thing to push, I think, would be good with the school nurses who may not feel comfortable in that environment or even the infection prevention and control setting because maybe they've just recently graduated from college, or maybe they've only worked at the bedside and maybe only with adults and different things like that. So really keeping that inquisitive attitude and like making friends with people that could be the subject matter experts within your facilities department and really kind of gathering the knowledge from them, being like, okay, what do I need to learn about what we're using in here and how that impacts the health of the student? So, yeah, as an infection preventionist in healthcare facilities, you got to make friends with the people who know what goes on and the different workings within the facility. And I think that stays the same within the school setting too.
Absolutely. And I think you bring up a really important point, and that is that we do need to all work together. We need to bring the expertise of our facilities team, our healthcare team, our food services team with food safety and handling, our transportation team. These illnesses can spread on our school buses. And that's something that sometimes school nurses get left out of those important conversations. We may bring the directors of a lot of different departments together for these powwows to discuss big problems. And sometimes the school nurse is left out of those conversations. I don't think it's intentional. I just don't think people realize the expertise that school nurses can bring to those conversations for a really well-rounded whole child perspective. School nurses need to be at leadership tables. So if I could advocate for that during this podcast, I would love to make sure anyone who's listening, make sure a nurse is at any decision-making table.
I agree. Because, and then what's unfortunate is that like the nurse doesn't know what she doesn't know. She doesn't know what
Exactly.
or he or she doesn't know what they're being left out of. So then you can't even work to prevent something or assist with something because you don't even know what's going on. So I agree with that wholeheartedly. You mentioned a little bit earlier about vaccine advocacy and getting the students vaccinated. Can you talk a little bit about that and what role the nurse plays in making sure that we know they got to look at like records and whatnot, but what kind of role do they play on actually getting the students vaccinated and making sure that they're following best practices and staying up to date?
Absolutely. School nurses play an incredible role in addressing vaccines and vaccine hesitancy. I mean, we are certainly aware of, that's one of the things we must do from a state level perspective is review immunization records, making sure that students are immunized. And for those who aren't, we're following up with those families. For some of them, it may be that they have a religious objection, a true religious objection. And then we also have those, I have to chuckle because, I attended church with some people who sent in religious objections. And I had to chuckle and say, I know that you don't really religiously object to this
Yeah.
immunization.
Chapter and verse. Where does it say that?
So in those situations, it really does help because a lot of people do trust nurses more so than they may trust other healthcare providers. A lot of times, nurses work with families in a lot of different ways and in a lot of different realms. It may be that we're identifying social determinant of health concerns. We realize that there's food insecurity and we help address that. We realize that there's a transportation issue and getting to health appointments. We can identify that and address that. And in the midst of meeting some of those really basic needs, people develop a relationship with the school nurse. And with that relationship, then we can have some more challenging conversations with families. Hey, what really is it that you're concerned about with this vaccine? Is there anything I can do to help you get this vaccine? Here's why I think this vaccine's important and why I think this vaccine is safe. And sometimes through those trusted conversations, by delivering facts in an understandable way from a trusted professional, families may change their minds. Now, many may not, but there are certainly families who will change their minds after someone takes the time to say, hey, I get why you have some of those concerns. That makes sense to me. But let me tell you some things I know too.
That's a really good point on making sure to understand the why behind their reasoning and not assuming that somebody is choosing not to vaccinate for whatever the hot reason is in the news. It might be something totally different and that they're very preoccupied with that food insecurity or that they just lost their job and it's just something could be not top of mind. And they may not understand how easy it is for them to get this vaccine for their child and it's not going to cost them anything out of pocket. Maybe it's something that you're having a pop-up clinic and it's just down the street and something as easy as that. So that is, I really like that, focusing on the reason and not assuming a reason and coming from providing that trust and the facts from a good and having that good relationship. And I think that would work could do wonders in settings that are even outside of the school system, where people sometimes just automatically are like, you need to do this because, and yes, they do need to, but we got to peel back the layers so we can actually have an effective and meaningful conversation. I want to dive into COVID because I feel like it deserves its own little section because
Ooh.
schools were upended during COVID and then having to rebuild and figure out what that looked like. And I know that you were working as a school nurse during that time. So just let's talk a little bit about your experience, what went on, challenges, how you tackled it, and then any like lasting lessons learned or even like policy changes that happened because of the pandemic.
We learned and experienced so much during the COVID-19 pandemic from watching rumors trickle down through different communication avenues to hearing on the news what may be coming our way. And then all of a sudden, leaving school one day, thinking that we would be back in just a couple days. And then we did not enter the school building for months on end after that. I really thought I had experienced some interesting public health events during my school nurse experience, whether it be the E. coli outbreak in one of my schools that made national news, whether it be working through H1N1. And man, I thought that that was a big deal when we were working through that. But COVID-19, it was like no other. And I hope we don't have to experience anything like it for a really long time. But it was definitely interesting to just experience how do we do school? How do we do life in a whole different way for weeks and months on end? So we had to deal, number one, with the concern of, oh my gosh, there are a lot of students that rely on school and the people in school and the resources at school, the food at school, the care and connection that comes with school. that are not going to have access to that. That was terrifying. So we had a lot of concern for our kids and wondering if they were safe, wondering if they could remain healthy without some of the supports that they relied on at school. So that was a major concern for us. And then trying to reach them and check on them, trying to educate them and allay fears. I'm so thankful that there were some amazing school nurses who had created some resources, wrote and illustrated books. One of them I picked up and created. I was learning how to use Zoom and record things like everybody else. And so just did a video and audio recording of me reading a children's book about COVID-19 and sharing that to all the children in the district, just so that we could help them explain in a way that they could understand what this event was that none of us had ever experienced before, and trying to allay their fears, educate them on ways that they could contribute to the world staying healthy and getting well again. So that was a learning opportunity for us. And then there was the trying to come back to school once schools were able to reopen, and figuring out how to do that in a healthy way. I got to work with a local pediatrician using this new platform that we'd never heard of before called TikTok, and making training videos about how to social distance, how to wear your mask properly, how to wash your hands properly, putting it to song and dance and making it goofy and fun, just hoping that we would be able to bring forth some positive energy in a dark time to help students know how to come back to school safely and stay healthy if at all possible. And then working through the challenges of social distancing. Probably one of the hardest things to do as a school nurse was contact tracing and communicating with families when their child had been a close contact and they couldn't come to school for the next X number of days.
Mhm.
And that was especially challenging because we had some students who were amazing athletes, and they were told, "I'm so sorry. You can't go and compete in the state championship in your sport because you were a close contact to somebody who tested positive for COVID." We upended a lot of lives through some of that communication, and school nurses caught a lot of flack for that. Um, I happened to do a study with the National Association of School Nurses. I was a part of a research team that sent out a survey to school nurses across the nation about their experience providing care during the COVID-19 pandemic. And the experiences were eye-opening. Some of them talked about, being cussed up one side and down another. Another said, "Someone slashed my tires because I had called them and let them know their child couldn't come to school." Um, just across the nation, school nurses were verbally attacked, sometimes even physically attacked, because of the role they were playing in trying to keep people safe, healthy, and in school learning as much as possible. So it was definitely something that changed nurses' lives. It changed school nurses' lives, and it really opened my eyes to the organizational support that school nurses need. School nurses need to have principals and superintendents who believe in their expertise, that trust their expertise, that lean into and utilize their expertise, that stands behind them. When they make a judgment call, when they use their nursing judgment, support that. They have the expertise to do that. Don't counteract it, but support that. So a lot of what school nurses said in that survey was just the struggles that they had with the tug and the pull between here's what the state policy says to do, here's what the local policy says to do, and then here's what the leaders in my school setting say to do, and all of them contradict one another. So a lot of struggles, but a lot of lessons learned amidst the pandemic.
Would you say, in your personal opinion, that schools, or just the ones that at least that you've interacted with, are more prepared to handle something of that magnitude again? Or was it kind of like, we handled it, we tackled it, we kind of figured it out, but like, it didn't really change behaviors or change policies or procedures. And if something else came and took us by surprise again, we'd probably have to start at ground zero
That
or
is
somewhere
a
in the middle.
That is a great question. And I struggle to answer it. I feel like I have like the angel and the devil sitting on my shoulders right now because there's one side of me that says, man, I think we learned so much. I think that we would stand upon the growth that we've made during this to do things better the next time. We learned how to handle this. We learned to pivot. We learned to do so many things differently in a short amount of time. We're going to move forward stronger and better because of that. However, I also know that COVID was really polarizing for a lot of people. And I feel like there's been so much misinformation about a lot of things. And I feel like there's been just so many polarizing views of the event that I'm afraid in some ways we still might start at ground zero because of that. So I'd love to think the best. I'm an optimist. So I hope that at least we've learned some skills. We've learned some communication tactics. We have learned to change when needed and go with the flow and be flexible. And at least in that way, we'll move forward stronger.
And I think your sentiment reflects the same in healthcare. I think a lot of people would say the same thing, that yeah, there's probably been some improvements, but I think a lot of it has been like it's over with and now we've forgotten. Even maybe when it comes down to simply like having enough inventory for something on hand for an emergency and stuff like that. I bet a lot of facilities have gone back down to a lower par on PPE and different personal protective equipment. And if we might end up being at a shortage like we were a few years ago. And I think that definitely we've learned some lessons, but I don't think it's done the overhaul that it probably should have done. I
Yeah,
ultimately, when it comes down to it, which is unfortunate.
yeah,
But
it is.
hopefully we don't have to worry about that again. At least ever would be great, but let's go for it in our lifetime. Let's go for that.
Yes.
Um, just to kind of close out our discussion today, I just want to let you share any like quick wins that you've had with infection prevention in schools, or any advice for future I guess there's multiple things you could share, or any advice for school nurses, and how everybody can help support a safer, healthier, infection-free environment within schools.
Sure. So I think that a great starting place for addressing infection prevention in schools is making sure that schools do have a school nurse. A lot of schools are still trying to limp along and support student health and well-being without an expert in student health and well-being. And so I hope that things will improve and that we will see more and more school nurses in schools. However, I know that there are some challenges to that funding, namely, and right now, I think that's even more of a concern in schools right now, is that there's not sufficient funding to support someone that isn't directly tied to education. But I encourage people to think outside the box and realize that healthy students are better learners. And so we are directly related to students and their learning abilities. So making sure that schools have school nurses, that they trust the expertise of school nurses, that they bring school nurse voices to the table. Don't just put school nurses in a box, just like Dirty Dancing, baby doesn't belong in a box. School nurses don't belong in a box. So we belong not just in a school nurse health office, but we belong in the hallways of the school. We belong in the board meetings at school. We belong in the leadership meetings at school. We belong in community organizations outside of the school. We belong in any place where we're talking about health, well-being, future success of human beings. Nurses have a place in those conversations. And so I hope that people will welcome school nurse voices when it comes to infection prevention, when we're talking about identifying health concerns, addressing them early. School nurses need to be a part of those conversations. And I encourage school nurses, if there's any school nurses who listen to this, prepare yourself to be that expert that schools need. Partner with your state school nurse organization, the National Association of School Nurses. Make sure that you're educated on these topics so that you can be the expert that they need, and practice from a holistic perspective. I talked about that school nurse practice framework. Realize that your influence expands far beyond the school nurse office. You have a place in quality improvement. You have a place in leadership and policy and advocacy. You have a place in all levels of community and public health. Equip yourself so that you can do the most to impact your students and their well-being.
Very well said. I think a call to action to end the podcast episode with today. So thank you so much, Andrea, for joining Hot Mic Cold Virus today. I've learned a lot, and I hope that some school nurses have joined and have learned a lot and feel empowered and will go out and really advocate for their students and continue to make our schools healthier and safer. So thank you again. And again, as always, you guys can reach out to me via email at rochellebeard@outlook.com, or you can check out my consulting website, rbipconsulting.com. I'd love to hear from you. And until next time, have a great week.